Take a deep breath. Now, what would you do if that breath cost money? What would you do? Cut down on food, on rent? Because that's what diabetics have had to do with their insulin. The price of insulin has been skyrocketing. In the last 7 years, it's more than doubled. In the last 20 years, it's gone up 8 times. Why is that? Well, it's a really simple reason. The 3 major drug companies, Novo Nordisk, Sanofi, and Eli Lilly, can do it. They don't have the competition. I'd call that in-your-face pricing, whatever the market will bear. But you know what? It's too much to bear for many, many diabetics. We know that. We know young men who've died. We know a young man who started a GoFundMe site, and he was $50 short of what he needed, and he died. We know Alec Rashawn Smith, who was rationing his insulin to make it go longer because he'd run out of insurance coverage, and he died. That simply is intolerable. Now, what are we going to do about it? The reality is that our president rewarded the former CEO of Eli Lilly with a job as Secretary of Health and Human Services, instead of demanding an explanation and holding him accountable. So that's why we have to take action. That's why we in the Right Care Alliance are targeting insulin. We're starting that right now. We're going to have petitions. We're going to have protests. There are going to be write-a-thons. You need to join us, because if we're going to win this, we're not going to do it with money and with influence. We're going to do it with people power. So you need to join us. Go to rightcarealliance.org, insulin, and join the campaign near you.